And welcome back to KOCO 5 Chronicle Project Community. An estimated 13.7 million children are obese. That's more than 18% of the kids who live in the U.S. And tonight, KOCO's Aaron Bew with a look at the scope of the problem for children in Oklahoma and across the nation.
Oklahoma ranks in the bottom 10 for health measures, including obesity, and it's affecting our kids.
What we're seeing is that our children are developing chronic disease earlier and earlier.
Dr. Ashley Whedon is a pediatrician with OU Medicine.
They're facing abnormal cholesterol levels that can lead to heart disease in adulthood.
Dr. Whedon says kids are facing a diabetes risk earlier in their life. Some preschool children even have liver problems that are likely a result of being overweight. Dr. Whedon says the #1 thing parents can do:
be aware of their child's health.
Experts say you should implement healthy behaviors at home, starting with the parents.
This isn't about a child changing their behavior. This is about a family-based intervention.
Talk about food and different activities.
So they're in school during the day, so what choices are they making at school?
Dr. Whedon says access to healthy foods is important as we fight the obesity epidemic.
And another easy thing to remember, the numbers 5, 2, 1, and 0. That's 5 fruits and vegetables a day, 2 hours or less of screen time, 1 hour or more of activity, and 0 sugary beverages. Better health for Oklahoma kids. Local lawmakers are studying childhood obesity. A state representative held a study in late October looking into just how obesity impacts illnesses like heart disease, diabetes, and cancer in children. And they also talked about possible solutions like fitness testing for students in PE.
I have taken it on in my position as First Lady to strengthen Oklahoma families, and this type of service is such an integral part.
New parents in Oklahoma getting a new kind of support. First Lady Sarah Stitt was on hand this month for the announcement of a new program. It provides new moms in the Women's Center at Integris Baptist Medical Center to receive ongoing support once they get home with their new baby. And each new mother is paired with a Promise Parent educator before they ever leave the hospital.
Programs like this offer a good foundational stability to give our parents the opportunity and the tools and the resources to be the best parent they can be in their situation, which in turn gives the children an opportunity for a bright and healthy future.
This program, called the Parent Promise Support Program, is the first of its kind right here in Oklahoma. Fighting mental illness in Oklahoma City Public Schools. Several community organizations are coming together to make it happen. OKCPS launched a new program this fall to fight mental illness. It's called Embrace OKC. The district asked for more than $5 million to fully launch it, and that money will pay for more counselors and social workers. It will also help pay for staff training on mental health and trauma. The district says students who struggle with mental health also tend to struggle in school. An Oklahoma school is now providing behavioral health care for students and staff. This is part of Shawnee Public Schools telemedicine services. It's through a partnership with Team Clinics, and the goal here is to minimize the amount of time a student has to miss school for appointments. The program allows doctors to virtually examine patients with the help of an on-site nurse. Oklahoma's State Superintendent Joy Hoffmeister was in our nation's capital, Washington, D.C. in September. She testified before the Education and Labor Subcommittee, and she talked about how students are impacted by gun violence.
There are, of course, the stark realities of poverty, childhood hunger, domestic strife, and more. The world outside the classroom has an undeniable impact on the world inside the classroom.
During her testimony, Hoffmeister stressed the power of authentic connections between educators and students, and she talked about how that's a way to mitigate trauma's impact on learning. Changing the way the faith community interacts with kids and families when it comes to child welfare. DHS teamed up with local churches and community members. They unveiled a new tool to help families connect to resources like local churches and groups.
There are 17 counties in Oklahoma that are already participating with the Care Portal tool, and our goal is to partner with the 111 Project to bring the Care Portal to all 77 Oklahoma counties.
The project allows the public to support those kids and families in crisis. Thousands of Oklahoma kids are being raised by their grandparents. Coming up, hear from a local woman who is still working past retirement age.